by Alonso Ortiz. The taxonomy of COVID is one that we're not used to, since COVID is a virus, and viruses are not alive. But to keep in mind for the scientific name of COVID, we need the genus, which is the beta coronavirus, and the species, which is severe acute respiratory syndrome, also known as SARS. Scientific name and characteristics. The scientific name of COVID is SARS-CoV-2. COVID is a round-shaped virus and an enveloped virus. That means that it is covered with protein, and it also has virions of approximately 80 to 120 nanometers of diameter. Discovery. The discovery of COVID happened at Wuhan, China, by a group of scientists from the government during December of 2019. History. As we already know, COVID was discovered in 2019 at China. From the discovery of COVID until February of 2020, there were already more than 2,000 deaths in China due to it. In March of 2020, the World Health Organization declared a global pandemic, since every country in the world already had some COVID. Vaccination campaigns started in late 2020. In 2025, COVID is not gone. It can still spread, but it's more controlled. Where it lives, COVID lives in infected people, infected saliva, infected surfaces, and in respiratory systems. Now, how it spreads. COVID-19 mainly spreads through respiratory droplets that come out when an infected person coughs, sneezes, or talks. Symptoms. The symptoms of COVID-19 are fever, chills, cough, headache, runny nose, shortness of breath, and sore throat, even though you can still have COVID without having all these symptoms. Body system affected. Along with the symptoms, COVID mostly affects the respiratory system, lungs and airways, but it can also affect the following systems: the cardiovascular system, heart and blood vessels, the nervous system, brain and nerves, and the digestive system, stomach and intestines. Scientific solution to fight COVID. A scientific solution that helps prevent severe illnesses and death from COVID is vaccination. According to the NFID, COVID-19 vaccination is the best way to protect against severe disease and death from COVID-19. How the vaccine works. Vaccines work by helping your body create protection against the virus without making you sick or causing the disease. This happens because the shot that you get has some death-provoking bacteria of the virus, so your body gets used to it without making you sick, even though you may still feel a little bit sick after getting the shot, but not a lot. How the vaccine is applied. Vaccines are usually applied as an injection to the upper part of the arm. Some people are scared of them, but the reality is that they help you, and the injection is not really painful at all. Effectiveness of vaccine. According to the NFID, about 65% of adults know that vaccination is the best way to prevent sicknesses, hospitalization, and even deaths. Additionally, it is estimated that among 1 million vaccinated boys between the ages of 12 and 17, vaccination would prevent approximately 5,700 infections, 215 hospitalizations, and 2 deaths. Prognosis with treatment. The prognosis with the treatment of COVID, which is the vaccine, is that your body knows how to fight against the COVID. So you may get some or a lot of the symptoms, which don't necessarily come in order, but wouldn't feel as bad as without the vaccine. Also, you're less likely to get it with the treatment. When you get it, you should rest and stay hydrated until it goes away. You should do this if you have or no treatment. If you still get it really bad, you should go to the hospital or to your doctor. Limitations of treatment. A challenge or limitation of vaccinating is that it costs, as some governments cannot afford to get it to the population. Also, it is hard to get it to some rural places. Benefits of science. The benefits of using science to treat the COVID is that discoveries can help you know more about it, even discoveries from other diseases. This leads to further prevention, effective treatments, and even public health. Ethical impact of science. During the pandemic, when there were only a few vaccines, people would debate or argue about who should get it first and why, because they wanted to be protected. This happened mostly with people with different conditions.